Dear Salzburg Fellow and faculty, thank you to invited me to participate. The topic today is interesting. It's one of the most important in the job I am in and in my day-to-day work. And it is leadership. Leadership, there are many things we can say about leadership, and there are some principles behind the leadership, the word leadership. Let me talk about my country, because that's what I know the best. In my country, we have our Vision 2020, we have our strategic development and poverty reduction strategy coming from that. Out of that, we have our health sector strategic plan. It's our third one that we just finished. And we implement it, and we have noticed great success. We have reduced by 50% mortality under 5. We have 90% of our children that are vaccinated for more than 10 vaccines. I think it's the best score in the world. We have 90% retention in HIV program, and I can continue. But my job is to go the next step. And for the next step, what can I do? Meaning, in the team in the ministry, we come together and we decide and we think, what can we do to improve the health of our population? In which area can we improve, or what can we start? And I'm going to give you an example that is not usual. Health infrastructure. Health infrastructure is also in our portfolio. And for health infrastructure, like everything, like creating programs, clinical services, you need leadership and you need to have a team. For the leadership, you need to take it, but at all levels. We create hospital. It's not for us in the ministry. We create hospital for the people. And we create it according to the plan we have. We have a great plan, making the health services and infrastructure at 1 hour of each and every Rwandan. This is our objective. And how we do that? We look at Rwanda, and we look where there is the biggest gap, where the people are working 3 hours, 4 hours, 5 hours. That's the place we put the next hospital. Now, we have the vision where to put the next hospital, but we cannot say we will put it here or there. We are going to the local leaders and we tell them, if we have to put a hospital in your region, what is the best place? What is the most suitable place for you? And they tell us the place. And then we bring engineers and they look what we can do with that place. Sometimes it's impossible, so we move a little bit. But this is the place where the population wants the next hospital. And we work on that. Meaning, now I have the participatory process, and I have community and population-driven decision. The next thing is, with who are we working? Because in the ministry, I don't have architect, I don't have engineer. Most of the people are nurses, doctors, program managers. So we have to communicate and work as a cluster. I invite the minister in charge of local government, because it's something in remote area. I invite the minister in charge of infrastructure, because it's a building. And together, we are going to plan, to follow the implementation, and meaning the monitoring and evaluation. I'm going to seek advice for the price, the best engineers, where to buy the best concrete at the cheaper price, so that I can do more. Meaning, we are working as a cluster. We are breaking horizontal and vertical barriers to be more productive and efficient for the population. But it's not enough. As we plan together, we have also to monitor and evaluate together. Because there are so many subsectors that intervene, so many stakeholders, that if you bring electricity and water and you don't bring the concrete on time, you have a delay. If you need electricity, you have the concrete and the water, you delay. meaning you need everybody on board at the same time if you want to deliver against your commitment, meaning monitoring and evaluation of something that you have created in transparency is key. And you need also to understand that there is no shortcut. You need the best concrete. You cannot say, okay, I'm late, I'm going to take this because it's near. No. You build something that needs to be solid. That's what our population deserves. Also, I talked about the cost. I talk about the best product, meaning you have to run it like a CEO, like business, making the most profit with the less investment. How I'm going to have the most health out of the investment I'm doing. Because the investment is money. The money is for health. How I'm going to produce the most health out of this investment. And also, I need to do that with flexibility. But not only, I need also to convince and to bring everybody in the vision. Because if the skills that are in the Ministry of Infrastructure, if they don't have the same motivation and passion, they will delay. They will come or not in the meetings. I'm going to be stuck with my plan because I don't know how to read a plan. Meaning I need to create a momentum, and a good leader is somebody that can move people, in your vision. And your vision will move people if it's a vision community-driven and targeting the most vulnerable to come and join the development journey of the entire country. And all this have to be sustainable. Example, this hospital is in the middle of nowhere because there were no care before. Meaning there is no house for the 100 nurses and doctors you are bringing. You need to create houses at the same speed you create the hospital. You need also to assure that you have the number of doctors and nurses, all the equipment, the day the architect will give you the key of the hospital. If not, you have a splendid infrastructure that is going to sleep there and doing nothing during months. So, the sustainability is the solidity and the quality of the system you give, and also the capacity of that area to retain doctors and nurses because you have built for them maybe a new city, a new center, when they can buy what they need, etc., when they can enjoy life. And the other thing about sustainability, you need to build that hospital with the best standards of the moment. It's not because you are poor that you have to go for understandard. Example for infrastructure, we have new technique for refreshing the air regularly, and it's very important in some diseases like tuberculosis. If you don't renew the air of a room, it's not good. You make the person more contagious, and it's dangerous for the health workers. So you need to use those new techniques that I have no clue, but I have to read about it, to own it, and to transfer that. All this is about leadership, meaning you need a vision, you need to bring people in your vision, you need to communicate and to create cluster, you need a good monitoring and evaluation, you need flexibility, you need to build the momentum, and you need to work for sustainability. But all this for your people.